The first step in doing manual lymph massage for yourself is to clear the area in the neck just above the collarbone. So you will be doing a pump movement, and you will be working downward towards this little U, right where the two collarbones come together. So it's pump, 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 pump. And you're going to do this 10 to 15 times. And when you become more adept at this, you actually will probably be able to feel your neck relaxing. The next step is Catherine will be taking 10 deep breaths. And she's going to breathe deeply from the abdomen. And you can see that my hand is expanding out or rising every time she breathes, and then goes in. And the reason for doing this is so that we can get the abdomen cleared out and the thoracic duct. 3/4 of the body actually drains into the belly, and then it comes up through the thoracic duct and empties into the bloodstream. The next step is knee pumps. Catherine will be doing 30 knee pumps. It'll be 15 on each leg. So she's alternating it, as you see here. When she does this, she is continuing to breathe. And again, the reason we are doing this is to help to clear out this abdomen. So we're creating that negative space for fluid from the body to drain to. So the next step is to clear the axilla or armpit on the unaffected side. So Catherine's block is here. This right arm is what will swell. So we're going to actually channel the drainage from this arm across to the left armpit. So we start by, again, doing that pumping motion, and you're pumping up and kind of in to that taut, soft tissue in the armpit. The next step is to clear the chest on the unaffected side from the breastbone to the armpit. So it's just a gentle gliding motion. You're doing just enough pressure to actually stretch the skin on the chest. And if you have two hands, you actually would be able to do it just like that. And if you can see, there is like just a slight stretch of the tissue on her chest, and that's all you're trying to do, just heavy enough that you get that slight stretch across that chest. And another point that I'd like to make here is if you have a port, you do not want to be moving that port around, so I recommend that you maybe work to the one side of the port into the armpit, and then you would work up to the port, like that, so that you don't dislodge the port or interfere in the port's function at all. Even though the nodes are missing on this right armpit, we actually are going to go ahead and do a little pumping there because there's probably some nodes there that are still functioning. So it's the same move as we did on the left side or on the unaffected side. A pumping move up and towards the neck in that soft tissue. Okay. Then we're going to actually continue to carry that all the way across now, the chest. So we're going to encourage fluid to flow from the affected arm to the unaffected armpit. And all of these moves are going to be done 10 to 15 times. Okay, the next step is to clear the groin on the affected side. We're going to create a second pathway that where the fluid will drain from the arm down this side and into this groin. And you can see this nice little divot right here. And what we're going to be doing is just pumping into that little divot and it's kind of going in and up towards the navel, and it's a rhythm about like a waltz. So it's 1, 2, 3, 1, 2, 3, a 1, 2, 3, 10 to 15 times. Kathy has done so well with her lymphedema because she actually lost weight after she developed lymphedema, and the weight loss really goes a long way towards helping people with lymphedema. Okay, so the next section that we're going to clear to allow the lymph to drain is from the waist down to that groin. And it is, again, just a stretching move over that hip, and then from the waist down and over the hip. Trying to do that same little stretch like you could see on the leg. And again, 10 to 15 times. Kathy, I'm going to have you show them how to do that with 2 hands.
Take one hand, put it on my back, and one hand on my hip, and I gently roll forward. The slight little stretch.
And 10 to 15 times. So the next step is to clear under the armpit and down into that groin, just like this. I can tell you that if you just keep working this area, that will drain for you. If you are actually a little overweight, you can use a brush like this, and you actually can do this during your shower so that it's part of your daily routine. But you can see how that brush allows you to get back here. You also can use gloves like Catherine's got on in the shower to help do the self-massage. And then the other thing are these little net balls. These actually work really well to help do massage. And again, 10 to 15 times, stretching that tissue. So the next step is to drain the arm, and we're going to start by clearing the pathways right over the shoulder, and it can go into actually the neck area. And you can see that tissue stretch every time I make that move up and over the shoulder. Again, 10 to 15 times. So the way Kathy would do this is she'll reach over with her other arm and bring it up just like that. This area, just above the elbow, because of gravity, tends to collect more on people with lymphedema. And what you want to do is just keep working it. And the same for the elbow. So work over that elbow and up and over the shoulder. If you're doing your own self-massage, you actually can reach through with your other arm and pushing up and getting that area we talked about and carrying that fluid up to the shoulder. So the next step is to clear the lower arm, and we're just going to do a twisting motion, that same twisting stretch to the upper arm. So this is clearing the pathways in that lower arm. Okay, Kathy, show them how you would do it. Good. And we're always carrying it back to the side of the arm is actually what we're doing, is going up the side of the arm. Okay, so the next step is to clear the wrist and the hand and the fingers. And you can see that I'm just using my fingers. So this is something you can do without too much difficulty. And it's stretching mid-hand or maybe just above the knuckles. You want to talk about your alert bracelet, Kathy?
I do wear a medical alert bracelet because as a breast cancer survivor that has had lymph nodes removed, it's been recommended do not have a blood pressure or an IV stick or an IV placed in this arm. So I wear my medical alert bracelet to alert medical personnel.
And I'm going to go ahead and just move on down the top of that hand. And if your fingers are swollen, for the hand and the fingers, if you will just keep working the tissue, stretching it, it'll help to develop new collateral lymph vessels, not nodes. And the more you work this, like when you're free time watching TV, this can come down. And that comes from Joanne Roveg out of Washington, D.C.